How's it, everyone, and welcome to another episode of Culture, the podcast. I'm here with a very special guest. Special for two reasons. One, she's our first doctor, and two, she's my cousin.
Yes.
So everyone, I'd like to welcome to the podcast, Dr. Marielly Mitchell.
Hi.
You are a doctor of occupational therapy.
Yes.
Right. So what is occupational therapy? What does that entail for people that may not know?
Yeah. So it's, I would say, one of the more challenging names to understand in healthcare because it's really misleading because everyone considers occupation jobs, but it can be further from that. So basically everything that you do is a daily occupation. And we are, as occupational therapists, our main goal is to help people live the most independent and fulfilling lives. So PT does walking and speech therapy does talking. We kind of do everything in between. So whether that's the occupation of driving and you just had a stroke, or that you had a traumatic brain injury and you need to learn how to feed yourself again. If that's a child that needs to be regulated and be able to sit at circle time and be available to learn, that's a daily occupation. Writing is a daily occupation. Reading is a daily occupation. And there's specialties that we can go into. So some, like myself, are like a sensory integration specialist. Some are stroke rehabilitation driving instructors. Some are feeding therapists. I'm kind of a hybrid of a lot of different specialties. And so basically occupational therapists, their goal is to help you do whatever it is that you need to do to lead an independent, fulfilling life. So if you were a painter and then all of a sudden you had you got diagnosed with like Lyme disease or something and you had like chronic fatigue, like we would help you kind of achieve the goal of getting back to painting, right? It can really vary. So it's a really customized type of like healthcare profession that really is focused on the individual and bringing them back to function, truly. So it really should be called like functional therapist, like what it is that we help you do to function. And we take a biomechanical approach. We take a lot of different frameworks like biomechanics, neuro, just client-centered, all sorts of different things. But we specialize in the hips and upwards, if you want to put it like specifically, and the upper extremities. So the like arm and all of this area. That's why for kids, it's mostly handwriting. And then for speech therapists, they're mostly in this region, but a lot of OTs will also focus in this region. But we don't go waist down. That's PT.
Yeah.
So.
Well, yeah. What I remember, because since my wife is a
PT.
physical therapist, she was trying to explain to me. She was like, you know what? It's kind of like occupational therapists they deal with the body, but it's almost neck up, where it's a lot of like psychological and neurological things that you're either inhibited or you have other other things that are preventing you from achieving just daily functions.
Totally, yeah. So like if you have like Alzheimer's or dementia, like there's specific OTs that work with that in like elderly homes and things like that. Or in like we also I had like a rotation in a psychiatric ward, inpatient and outpatient. So we also work with the brain, like significantly cognitive function. So that's for also children with like working memory or ADHD related to like impulse control, organization, behavior, attention, self-regulation, emotional regulation, all that kind of stuff. And then it's really like it's and then like there's OTs that do where they're like CHTs, they're certified hand therapists, which is advanced training. And they'll literally be the ones with like workers' comp kind of thing more so, and be not partnered but really like intertwined with a hand therapist and only do like carpal tunnel and like carpal tunnel surgery and like injury when someone's hand gets smashed in a machine. Like it can vary from like this area up, and a lot of cognitive ability.
So when you're going to schooling, when you become an occupational therapist, is it the broad spectrum of things? So you just focus on the entire body when you're going through your schooling?
Yeah. So
then afterwards is that you start getting into these specialized like.
Yeah, so you basically have like a very foundational education starting with like kinesiology and anatomy, which is like physiology and things like that, which PTs do as well.
Which would be your undergrad.
Undergrad and kind of prerequisites for grad school. But like the academic courses have changed. Like I'm like 12 years out practicing since like 15 years ago, but like closer to 16 that I was in school. So like things have definitely changed since then. But you have this foundational type of education, and then you go through like at the time my tracks were like you had physical disabilities class, then you had like neuro, and then you like neurology, and then you had pediatrics, and so you get like a little bit of everything, right? And then everyone kind of starts to be like, oh, like this really resonates with me, or like, oh, I really did not like that, or like, oh, I really don't like making splints, or oh, I really like doing this, right? Or I really am drawn to the hospital, or like I really like cardiac. So we kind of get like a dose of everything a little bit, and then and then we specifically like will get in our second year we had the ability to kind of choose our electives. And so you'll choose electives that you're more drawn to. So from the beginning in grad school, I was like really fascinated with this like region of the body. So I took my first like swallowing course there, right? And I was like, oh my God, there's so much going on in this part of the body, because you need like advanced training to work in that area as an OT. Speech pathologists get that ingrained in their knowledge base in schooling. And so you start to basically like taper and go into different kind of like categories or funnels. And then you kind of follow that as you go. And then once you graduate, you're free to do what you want. And people can either like do advanced training or not. Like there's some OTs who aren't specialists in anything and they just work in hospitals more, and they might just become more like they do ortho or like hips and stuff, and or hips and knees, a lot of those replacements, those kind of surgeries.
But very generalized.
They'll be kind of more general. They'll be specialists in that area, but they don't have like certifications and stuff per se.
Right.
But like in the like for that, like the occupation of like sex and intercourse, like they help people with like total hip replacements, like know how to do that safely, right? Like it's like we work really intimately with people, like after they're going to the bathroom, like wiping and all that kind of stuff, like showering, like those are things that in OTs when they're in the hospital or skilled nursing facilities, that's what we kind of help with a lot. It's like the not so glamorous things that like you need to learn to kind of actually do to function.
The basic functions of life.
Brushing your teeth, that, washing your face, like
they have like fine motor skills, but at the same time are very involved in other aspects and are very key to keeping you
totally, like if you can't grip your toothbrush, like we got to figure this out, right? Or if like you have not had a stroke and you can't squeeze the toothpaste on the toothbrush, like for a reason, like we got to like adapt that, or like putting your shoes on, right, or things like that. Spinal
like
cord injury,
Parkinson's, and like
tremors and like weighted spoons, or like a spoon that stays still even though you're tremoring. It's a whole, we modify the environment, but we also, as much as we can, but we also want to have providing skills for people to be independent and like happy, right. So
return to the most normal lifestyle that they can possibly have.
That's the goal always.
So that being said, when you got fascinated with this area of the body, you decided to like start specializing on breathing and other aspects of
so actually so in my field, basically where it starts is you become more like a feeding therapist. And what I originally started, where my fascinations kind of started, where my specialty started, was first in sensory processing, which is the way that your body and your brain interpret information from your environment to give you the information and data that you need in order to have an adaptive response, right? So like the sound of traffic right now, like I can filter that out and focus on what you're saying. That's my auditory system. Like the lights, that's not bothering me, and I can focus on you, right? People with maladaptive sensory systems that are not integrated, those kind of things can't function correctly, right? And then those distract them from being available to what's they need to be doing. So you can be hyper responsive to something where you're up here, then you can be hypo responsive and you need it. And everyone's trying to be in the middle at a level optimal arousal, right? So hyper responsivity to vestibular input, which is like movement and swinging and things like that, those people get car sick. And then the kids who are constantly spinning and on the go, they're hypo responsive. And everyone has a unique sensory profile that is the foundation for your motor skills. Because if you can't feel or see where your body is in space, you can't use it well, right? And so I got really fascinated with that. And this is a neuro concept. And so I got really into neurology. That was like the first thing that was like my first love in grad school. Like the brain and the spinal cord made so much sense to me. Like kinesiology, I was like, derp. Like I was just like, this is not like, I didn't get it really. I did okay, but neuro really like was my thing. And then sensory processing was this like second level of it that was even more abstract. And I was like really fascinated. And so I specialize in that. And in that, you get you start working with more selective eaters, because a lot of children who are like selective eaters, which we used to call like picky eaters, but now it's more appropriate to call them selective eaters. They can have a lot of sensory processing challenges because their mouth, whether it's like taste or like touch or perception of the pressure or the temperature of the food, can be really bothersome to them. And that's just one way to look at feeding, right? And so I got into working with selective eaters, and I was really kind of just like fascinated by the whole dynamic between like the family and like the actual nutrition that they were eating, and then like the behavior behind eating, the sensory processing behind it. And then I started really like sitting and kind of pondering with like the clients that were plateauing, like what are their motor skills? Like these kids like can't really chew very well. Like, and you have to remember, if you're anyone, like no one can see their face. You have to rely solely on sensory processing. And I kind of started getting more into motor skills about the mouth. And once I started like connecting like the sensory and the motor component to that more, that's where I started getting more into this region. And then I started working with patients who had feeding issues and also strokes and different things like that. And they started seeing physicians that are called osteopaths,
Mm-hmm.
which are the doctors who work with the bones of the skull. And
Mm-hmm.
they're an amazing, amazing set of clinicians that not a lot of people know about. And I was working with one and we shared a patient, and we met up one day, and that person was telling me about a course I should consider taking with like related to like the tongue and tongue posture and breathing and all those things.
Mm-hmm.
And that was the course, which is called like orofacial myofunctional therapy, which is like a really long way of saying like the muscle complex of this area of the face.
Mm-hmm.
And that was the course that like really revolutionized the way I like look at things,
Mm.
because I learned about like mouth breathing. I learned about like the importance of breathing through your nose, what happens to the nervous system when you're mouth breathing,
Mm-hmm.
how these structures, if they're not actually in the right place, how everything here is made of soft tissue, that it's collapsible. And the main thing in there is that your airway's there. And when your
Right.
airway is like being collapsed on or it's not functioning correctly,
Or the muscles atrophy.
yeah, all sorts of things, right?
Right.
Like this is like a, you know, like a rigging system with like
Mm.
tents and stuff like that, like
Right.
at a
Right.
wedding or a circus, and
Right.
like
It's all structural.
you
Yeah.
know, one pole goes down, it's like everything comes down.
Mm-hmm.
That's what this area of the body is, because there's no hard bone like an ulna or like a
Right. Right.
radius, right, or like a femur. It's just very soft tissue.
Mm-hmm.
So you're at the mercy of soft tissue in a very fragile, like very critical part of the body. And so when I started learning those things and how it impacts sleep,
Mm-hmm.
I was like, I feel like I got hit by a car that day, and I'll like never forget it. I was like, oh my God, like it doesn't matter how much I put a kid on a swing or tell them to be on a trampoline. Like if they have airway issues, like their nervous system isn't even like available for me to like be stimulating it to
Right.
calm it down really.
Right.
And so, and I started really digging in that, and that had never been brought to my attention because I was like the second OT like in the country to take their course. And
Right.
this is back in the like 8 years ago, before Breath and James Nestor, who like really put this kind of stuff on the map, which is like what your co-host knows about.
Mm-hmm.
And like when I learned about it, it was actually like kind of taboo because the technology wasn't there to measure all the sleep stuff that people were seeing clinically, but like sleep tech wasn't there. And just to get someone to a sleep study lab was a lot of work.
Mm-hmm.
So you couldn't really like validate what we were seeing clinically because the technology and the availability of it was so slim.
The science
right?
was new. Yeah.
The science was new.
Right.
It wasn't actually new science. It was more so, it wasn't as like validated because the technology wasn't there and like there weren't that many specialists. Then James Nestor came out and like really like he has no skin in the game. The
Mhm.
book is called Breath,
Mhm.
and it's like there's so many good books. Like I have them on my website. That's like my favorite books, and that's my favorite one for anybody who wants to know about this stuff. And that book, that guy is an investigative journalist who really just went into this field and like shed so much light on it about how like our jaws are atrophying, our mouths are getting smaller, thus our skulls are getting smaller and our brains are getting smaller. Everyone's having these airway sleep issues that are wreaking havoc on your nervous system for like ADHD, anxiety, depression, all this kind of stuff, right?
Right.
Because your breath and your nose control your nervous system, and he
Right.
really he's not
It's
a
the
therapist.
delivery because I'm a big fan of Andrew Huberman. He
Yeah.
talks a lot about it, and he's mentioned
He's
it.
another one. Yeah.
Yeah, there was a book actually in the 1800 called "Shut Your Mouth," I think, or "Close Your Mouth,"
Mm-hmm.
and
It's a great book.
Yeah, and
It's
it
like
talks about I mean, it's at a basic level, but as the science came on and there's more research that's done, I should have said the research was very nil and
Yeah.
new.
Yeah.
Because a lot of people it was discredited a lot.
Totally.
Yeah,
Totally.
where
Yeah.
now that you realize that even at the molecular level, where like what's it like the nitric oxide
Nitrous oxide. Yeah.
nitrous oxide that's created when you breathe through your nose specifically.
Only through your
Yeah,
nose.
only through your nose.
Only
Like,
through
you
your
can't
nose.
get it through your.
You can't get
through-
it any other
yeah.
way. Yeah. And so, yeah, that's exactly it. So nitrous oxide is only created through your nose when you're nasal breathing. It's not through your mouth. And it's one of the foundational gases to create like chemicals to create the oxygen absorption that you need. And
Right.
like, and there's also like a whole nother like level to it of like carbon dioxide too.
Right.
There's this balance of all of it. And like, we're kind of just scratching the surface about it. And
Right.
like, we're still measuring like O2 sats, but that's like it's a good measure, but it like something has to be fatally wrong to get like for it to be low. Do you know what I
Right,
mean?
right,
Like
yeah,
a kid
yeah,
who's
yeah.
mouth breathing isn't going to show anything on an O2 sat level.
Right.
Maybe in their sleep if it's really bad and they're like
I mean, even
pre-symptomatic.
people that were suffering from COVID, you know, even how bad that was in a respiratory sense, the O2 levels weren't even very indicative of what
How
they were going through, how bad
yeah.
it was. Yeah.
Yeah, but when it got really bad, it was really bad.
Right.
But
Right.
that's why they also put them on their stomach and put them in prone position to
Hmm.
make it easier for their lungs to expand so
Hmm.
they didn't have to fight gravity against the bed and the
Right.
weight of gravity. So you flip them over. And that's
Right.
why when you see babies who sleep with their butt in the air
Hmm.
and they're on their tummies, that's called tripod sleeping. When you see that consistently and you see that with other issues of like sleep disordered breathing, like teeth grinding or snoring or things like that, that
Hmm.
is a sign that that child's trying to help their lungs expand better
To get more oxygen.
to compensate.
It's a
Mhm.
natural
Same with people who
reaction.
sleep on their stomach. It's not any
Right.
different. Like I specialize in pediatrics,
Interesting.
but truly like what I know is it's a universal. It's very niche my
Right. Right.
knowledge,
Right.
but
Right.
it's universally
It's
applicable.
the foundation, basically. It's the
It's the
foundation of
foundation.
what, if
Yeah,
you have these, if you have sleep apnea, all these other things, it all stems from when you were a kid. You never got the proper amount
totally.
of oxygen
Yeah.
in the way you were breathing and things like that, and the structural issues that maybe you may be having that you don't even know about.
Totally. And your nervous system could be a wreck because of it. So like I come from this like, every kid that comes to occupational therapy is typically like, he can't sit still in class, he's biting his peers or he's pushing or
Hmm.
like, impulse control or like he just doesn't want to read or like writing is so hard. And I'm like,
Hmm.
okay, cool. Like you're here for writing. Like let's like that traditional occupational therapist like super got that under control. That's like to us that's very like
Basic.
basic,
Right.
but we do it and we
Right.
love
Right.
doing
Right.
it and like but there's nothing wrong with it being
Right.
basic. It's so appropriate.
Right.
But I come from now that I know what I know, I'm
Yeah.
like, Johnny's kind of not available to do handwriting. And
Yeah.
I have to explain it to the parents and be like, look, like your kid's not sleeping, he's not breathing, he's in fight or flight. Like, I'll do handwriting, but you're gonna be here for 3 years. Can we try to
Right.
get it to a year and a half? And can we like get his adenoids checked, his tonsils checked? Can we like
Right.
get you to the right dentist? Like, let's get this kid breathing and sleeping. So like what would probably have taken 2 years to teach him can take 6 months maybe.
Right.
You know what I mean? And like sometimes kids organically will already have like deficits there. And
Hmm.
like I'm not saying that fixing their breathing all of a sudden gives them motor skills
Right.
to
Right.
make
Right.
be an NBA player. That's
Right.
not the case
Right.
here. But it makes them more neurologically available to be rehabilitated.
Right.
Right?
It gives them the ability to tap into their full potential of what they
Yeah.
are capable
Yeah.
of taking in as far
Yeah.
as
The neurons will
neurally. Yeah,
wire.
you're right.
They will
Exactly.
fire and they will wire, but when you're so oxygen deprived, they won't fire.
Hmm.
You know what I mean? Like they will fire because your brain is just focusing on like getting the basics of like heart rate and like blood pressure and oxygen and all these things, and it can't do other things if it's
This
so
may be a
tired.
drastic analogy, but it's I think of it as the equivalent of holding somebody underwater and then be like, "What's 2 + 2?"
Totally.
And it's like when you're focused on like I can't breathe and I'm you're panic and it's the same kind of again this is an extreme level, but yeah, it's the same kind of you can't expect yourself to be neurally cognitive at the time when you're so oxygen deprived that you're so
Totally.
focused on just I need to breathe. I need to
100%.
breathe, and there's things that you become more irritable, you become more temperamental, even things from like food aversion and all kinds of things is what I've kind of like come to find. This is all stuff that I've heard, not that I know.
Yeah.
I
But
want to
you
be
know a
very
lot.
clear. I want to be very clear, everybody. This is all stuff that I've heard, not that I know.
You're pretty accurate though. I gotta
Yeah,
give you-
which is why
Yeah.
I wanted to have you on and talk about some of these things because I know, and Roman's a big fan of like Wim Hof breathing and other
Yeah.
things like that. And we were actually talking about Ashley and I were talking about getting into cold plunges.
Yeah.
And you start realizing the importance of breathing, even in that scenario, how much you can control your nervous system just by breathing. And I think that's one of the best ways to get a good idea of the connection between your neural system and your physicality
Totally.
and how they interact.
Yeah.
And
Yeah.
and then you realize how basic it is and how fundamental it is to have breathing be such a big part of that.
Totally. Yeah. And I'm a big proponent because I'm a healthcare professional of like, let's make sure like the basic needs of this human being are met before we jump to any like psychological issues, neuro
Right.
issues, etc. So like there's this like pyramid of learning that I have. It's a triangle. It looks like that thing from high school where it's like proteins and like fats and all that.
Right.
But it's like basically like here's higher executive functioning skills, academic learning, language, cognition, etc. Here's sensory processing, here's motor skills, and here's like bilateral motor skills, more complicated ones like coordination.
Right.
And it's had just that, right? And so I modified it and put like airway, elimination, nutrition, and digestion
As
the foundation because like so many people don't they overlook that. Even my profession,
they
like
neglect it.
so many OTs get stuck on sensory, and I'm like, can we look a little bit deeper?
Mhm.
And like I'm actually speaking at a conference in in a couple months for my profession, and I'm gonna be like kind of rocking the boat a little bit, being
Yeah.
like, hey guys, like you might not want to like look a little bit deeper because like we're not trained to do that, right? And
Right.
like people really need to, because the biohackers have brought this to light so much because they have money, right? And
Right.
they have really like brought this kind of science to the forefront. You don't see this in traditional healthcare, which is insane.
Right.
And but it's all backed in science, and it's moved faster with the research because it's in the biohacking world. And
Why
like
do you think that is? Do you think it's because the results are less tangible than
I think it's that I think it's from it goes to the educational system and the education that healthcare professionals like face and the what they're
Mhm.
exposed to, and that's not part of our curriculum, right? And
Mhm.
a lot of people who are in practice now are not being taught things that are being found in like the like future cutting edge stuff
Mhm.
in the biohacking world, right? And so there's this gap between educational systems and what is actually like being found with like new research and data with like Huberman and things like that,
Right.
right? But like tip usually this research in general is like 5 to 10 years, maybe sometimes 15 behind of what's actually being done clinically and being seen.
Mhm.
And a lot of clinicians get really like, obviously first is always do no harm, but a lot of people are like, well, the research doesn't say, and I'm like, well, if we would have like what are you going to do, just like let the kid have tonsils grade 3 for until they're 20, and
Mhm.
then like they don't grow, and
Right.
then they have anxiety because they've never been breathing their whole life, like
Right.
you have to kind of
Like,
like
when do you start?
you have
When
to
is yeah.
zoom out and take the whole
Right.
picture and look at the quantitative data
Mhm.
and the qualitative data of that specific person, and in general like any decisions you make, like yeah, like even like there's new research with like cold plunging, for instance, right? Like I
Mhm.
was reading, I forgot the name of this girl, but she has a really good podcast, I'll send it to you later, but she talked about cold plunges for women, and like
Mhm.
they're good intermittently, but women shouldn't be actually under so much stress all the time, like
Mhm.
from a physical perspective, because it does something to our mitochondria and changes the way like we, because we're supposed to be giving life and be available to be basically like
Mhm.
producing life at any point in time. Constant stress like that, like oxidative stress, like not oxidative, but stress like that's actually not that good for us.
Mhm.
For men, it's great, but for us, it's like doing like when she was talking about how when some like a lot of women just cold plunge all the time,
Right.
their body goes into overdrive stress mode and they like can't lose weight and they're actually more
Mm.
inflamed. And I was like, what? Like really? Like, because I come from like a medical professional background where it's like, oh, inflammation, ice it,
I said right.
right? Like
Right.
ice it. But
Right.
she's like, no, like you can't, if you're not injured, like, or if it's like that for women, it's a thing. Molly something.
Mm.
She's like kind of like a female Andrew Huberman. She's amazing.
Well,
But
see, even with inflammation, that's always something that, like, this has always been my kind of like quarrel with the medical field, is that everyone, and I think this is just the way society's come to see things, is that everyone thinks that everything is very matter of fact when it comes to medicine, and when it comes to treating things, and they're like, well, 1 + 2 = 3. This is how, so it's like, this is how we do things. This is how we do things, but not realizing the nuance of people's like biology, and how it
yeah.
changes so much, and how like, so there's people that respond very well to icing for swelling, and the swelling goes
Yeah.
down right away because of the fact that it closes up
Hmm.
your your blood vessels constrict and everything like
Capillaries
that,
and
and the
things. Yeah.
capillaries, everything, and so
Hmm.
it helps keep the fluid from, because naturally your body's saying we're damaged, send fluid, send fluid, send fluid.
Hmm.
But not only that, some people actually with heat will their body works better. So it's actually like when you put heat on it, it actually helps get the fluid in and out faster, as opposed to
Yeah.
just
Yeah.
freezing. So it's like this person may respond very well to icing, and get inflammation out with icing, while this person is the opposite.
Totally.
It's like, no, no, no.
Yeah.
If I like so if you're having, say, like an allergic reaction to a mosquito bite, or a spider bite, and your hand gets inflamed, right, and your body's like sending stuff because it's dealing with the poison at the same time, it makes more sense to heat it as
Hmm.
opposed to cool it,
Hmm.
because the cooling will help try to bring the swelling down and help with the capillaries, and get everything, and constrict everything and get everything out. But you actually need the heat to get more blood flow in it, to get
Yeah.
all that stuff
Let
out of
your
there, and
immune
get all
system
the
respond.
infection on, yeah, because your immune system's starting there to start repairing
Totally.
the things. So
Yeah.
if you ice, you restrict a lot of that blood flow to get there, to start taking care of that. So people like see like, oh, it's swollen, put ice, and then
Exactly.
yeah,
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 there's no universal law
yeah.
with health, and other than like nasal breathing is for
Hmm.
everybody. Like
Yeah.
that's the only one that I can think of
Right.
that is like the only kind
Well,
of like
without oxygen, you're done.
you're done.
You're done.
Exactly.
Right.
So that's the only one that's like for me. There's no like one size fits all
Hmm.
except like don't mouth breathe,
Hmm.
which is like it's crazy to think about it, but everyone is like so individualized in that way, and
Mm,
like people like process things differently. People have,
right.
and now with like epigenetics and like all of the stuff that's in the food and the environment and all these things, and people have like sensitivities to all sorts of stuff. Like
Right.
we have like evolved in the past 200 years with all the toxicities like in our world that like
Mhm.
everyone's kind of different. Like there's women who like should take folic acid and then folate acid, and like it all goes like our genetic makeup, and
Mhm.
knowing what your genetic makeup responds well to is like so important for people. And
Mhm.
like knowing that about you yourself is kind of one of the best ways I think someone can like empower themselves to make informed like decisions on their medical
Right.
care, which is I think a lot of people don't. They just blindly trust the person in front of them,
Right.
which
Right.
we're groomed to do that because that's how our society is function, right? Like
Mhm.
doctors are put on a pedestal for a reason because they know a lot of information, just
Right.
like how attorneys are, right? They've studied a long time. You trust what they say. They should be keeping up with their research, all that stuff. But you have to remember, like, they're also humans. They
Right.
they face burnout, like
Yeah.
especially like taking insurance, like the meetings are 15 minutes,
Right.
like they're
Bureaucracy and
it's a whole
and
thing.
all the things that go behind that, and how much,
Mhm.
ultimately running a hospital, running a clinic, running everything is also a business.
It's a
There's a business
yeah.
aspect, and you got to realize what's more beneficial for your business, so you can treat more people. Because the thing is, you go out of business, you can't treat people.
To an extent, but I
Yeah.
mean, like, I feel like it's like I feel like at least most people I work with, like, because of like, there's never like there's never a shortage of patients. Let's put it this way, because
Hmm.
unfortunately, there's a lot of sick people, and like, it's actually kind of terrifying as like a human being to be
Right.
like seeing how many kids are walking through my door with ADHD, and I'm just like, oh my god, like
Yeah.
this is getting really out of hand. Like, for instance, like just this week, I've had the conversation of tonsils and adenoid surgery 6 times,
All
six
right. Let's
times.
reset, and we'll pick
Yeah,
up right there. All right.
totally.
All right. All right. We're back. And so you were saying about ADHD and like that. So.
Yeah, so I mean, it's just like as a so one first and foremost, I'm a human, right? Obviously, and like second, I'm a clinician, and third, I'm a woman, etc. Blah blah blah. But like, or whatever, however you want to put that in, but like,
Which all plays a part, which
all
is
plays a
important.
part. Yeah,
Right.
right. Those are different lenses that I
Mhm.
see the world and see people and all that as I try to be. I never try to have like any influences with those things, but like I'm a human being,
Right.
right?
Right. Right. They
And
affect you.
and I'm also like a biohacker. So
Right.
like I'm kind of always
Now,
a
by biohacker, you mean?
yeah, like that's something that like Marielly as a person has been always fascinated with. Like I take a ton of supplements. I'm into red lights. I'm into sauning when it's
Right.
appropriate, like ice baths.
And,
Like
and so for people that may not know what biohacking you mean it in the sense of hacking your biology to kind of be in its most proficient
yeah,
or
I'm trying
optimal.
to optimize my health as much as
Hmm.
possible and to basically eliminate anything in my diet, in my lifestyle, and things like that. With like as long as it's like sustainable for me to make my body work as best as possible, because
Right.
you have to remember the body's a bunch of systems of like pumping and dumping and filtering, and
Hmm.
like when something clogs is when something happens,
Right.
right? And when something can't fire, there's a compression. That's when the nerve stops working and the muscle stops working or whatever.
Hmm.
If you tear something, that's the thing. So I know that like if my body doesn't work, like I can't work. So like
Hmm.
I need to take care of my body. So I've gotten into the biohacking world.
Right.
But to rewind back what we were talking about,
Yeah.
so we were talking about like so me as a person, I have different lenses that I see things,
Hmm.
and I think that's what makes me a clinician in the sense that is not just so traditional. And I'm like, I know there's a box, but acknowledge the box, but I'm very like out of the box too. And I try to
Hmm.
like look at things from lots of different lenses. But the amount of kids who are walking through my door with symptoms of ADHD
Hmm.
is like terrifying, like for
Hmm.
our future, in the sense of it's like I'm very neurodivergent and I'm very like neurodivergent positive and everything. And but it saddens me that like so many kids struggle
Hmm.
really, and like it's hard for them to kind of function in the school systems that we have right now,
Hmm.
because there's not as many accommodations as there could be.
Hmm.
And the thing is that so many of these kids are also coming in with like really enlarged tonsils and adenoids, and that is something that these kids, like, that didn't happen overnight. They can grow to like pretty quickly, like in 6 weeks and stuff, but that
Hmm.
means that that child has had that for at least like 6 months, 3 months, right? And like these kids eventually have to face surgery, like, or we try all the non-invasive paths, like rapid palatal expansion, which is when they put a palate expander and they
Hmm.
open up this, but you're accommodating the problem. You're not actually solving the problem,
Hmm.
right? And typically the ENT will prescribe like steroids or Flonase to like try to remediate it, but immediately once they're off, they come right back,
Hmm.
right?
Hmm.
And what happens is that kid's not sleeping well. So when they can't sleep well, they can't pay attention, they can't regulate, they have poor behaviors, etc. And like it's just like this week alone, like I've had 6 conversations about tonsils and adenoid removal surgery.
Mhm.
Like that's how much it's happening. And that's like, whoa, like this is a thing that like as a society we need to start paying attention to, because kids who aren't breathing well, they're not sleeping well, they're not growing well, their brains can't function, like their nervous systems are going to be a wreck, and it sets them up for this neurological tone into adulthood with like anxiety, like not being able to like make decisions, like not organize things. Like it really like is a detriment to their overall like daily life and function. And
Mhm.
you can do things when they're younger, and you have to do it early. Like people are still also like in the mindset of like, oh, they'll get orthodontics when they're teenagers. Like,
Mhm.
no, people don't understand that there's dentists that we put stuff in the age of 3 because 80% of the jaws develop by age 6.
Mhm.
Like you can do like the mild munchie thing on my Instagram, that reel
Mhm.
got a lot of attention because that's the earliest like non-invasive orthodontic treatment you can do, because kids are so malleable, like they're like Play-Doh. That's
Right.
why babies' heads, if they're on their back for too long, the head gets
Yeah,
flat,
get
or
flat, right.
like it gets like crooked on one side or torticollis.
Mhm.
Like they're literally like Play-Doh for the first like year, 2
Mhm.
years of their life. So their face and their bones will adjust to whatever's in their mouth.
Mhm.
Your mouth is like the core of your face, and if it's not holding things up, which is your tongue, everything around it will start to shift and change. And
Mhm.
that's what causes an airway issue. That's what impacts sleep. That's what facilitates mouth breathing, which then the like I talked about the fragility of this area, then when that starts to collapse, that impacts your brain. And that's where it really starts to kind of go a little bit haywire. And then if you throw adenoids and tonsils on a very narrow
It
space,
just constricts, yeah,
it's
yeah,
just it's
right,
just there's no airflow,
right.
right? And so it's really like it's just as a clinician and as a person and as like, someone who wants to have kids later, I see these parents and I'm just like, I feel for them because nobody wants to have their kid have surgery, right? This is like
Mhm.
your most precious thing in the world. And like I try to empathize and understand that as much as I can with someone who doesn't have kids yet. But
Yeah.
like it's like,
The risk to reward.
the analogy that you talked about, like having like someone's drowning, you're asking what 2 plus 2 is. Like I
Mhm.
tell parents, I'm like, it's kind of like someone's holding a pillow over your kid's face at
Mhm.
night. Like these kids are like waking up screaming, having nightmares, getting up, grinding their teeth, snoring, like, and they're irritable when they wake up, or they're grumpy, or they're like tired and wired.
Mhm.
Like they're just these like raw little nervous systems with emotions that already are going through a wild ride of development. And then you throw in this airway stuff and it's just like it's like it wreaks havoc on their like development.
Especially since, the first 3 years of their life is the most pivotal when it comes to
Their brain
development.
development,
Yeah,
like
it's
80% of their brain is developed. So
you're right.
if they're oxygen deprived at that point in time, like you can do actual brain damage.
Right, right,
Yeah,
right.
and like parents are terrified of that because you don't. But then it's like they don't want to do surgery, and I'm like, we've done everything now. Like
Right.
there's nothing we can do. Like, and like as a therapist, like I have to educate people and be like, I can't try to close your kid's mouth if they have enlarged adenoids. There's nowhere for the air to go because the back of the nasal cavity has now been blocked. It's not going to shrink, so my therapy is ineffective. So
Mhm.
I need you to remove them so that we can actually train them to close their mouth.
So they literally can't nose breathe because of the fact that
Yeah,
they're so backed up and so
it's literally blocked.
constricted back there.
Yeah, like it would be great. Like I can show you an image. I don't know if you do this on your podcast, but like to pop up an image of
Yeah,
blocked
yeah, yeah.
adenoids, because you can see in the anatomy, because when the air comes in through the mouth, it floats up first. Not necessarily always, but it just comes in, right?
Mhm.
The adenoids are at the back of the nasal cavity, and it's why it does that, why those enlarge and become these like bean bags full of like bacteria and viruses and skin cells and dust and
Mhm.
dog hair and whatever, all this stuff that you shouldn't be getting in through your mouth. It's because it's trying to protect it from going into your
Mhm.
lungs, right? And
It's a
then
filter. Right.
and once it's not a filter, it's actually part of your lymphatic system. And your
Mm.
lymphatic system collects it to protect your lungs and your actual airway. When those cap out and reach 100% capacity, then your tonsils are like, okay, I guess like we'll help because like they haven't figured
Right.
this out. Like there's nothing, we have to kick in now, right? But when the tonsils are enlarged, like now there's nothing,
Mhm.
and it's blocking everything to tell the body something's wrong, right? But when
Wow.
you nasal breathe, you have literally 3 filtration systems through here, like an air conditioner with
Mhm.
many filtration systems in there. And then your nose hairs humidify things, but they also create a microbiome to kill bacteria and viruses in your nasal cavity,
Mhm.
to collect everything and make boogers and or get it out of your body and
Right.
you expel it,
Push it back
right?
up, yeah.
And like your mouth does none of that. Your mouth like talks and it eats and it swallows and it does a bunch of other things, and it will breathe if you need it to.
Right.
But if you use it for that function, it's going to not be able to do the other things well. And so that's the problem, is like if you have enlarged adenoids, like you can't even try to get a kid to nasal
Nose breathe.
breathe because they can't. And like a
Excuse me.
lot of parents will be like, well, should I just tape my kid's mouth? I'm like, no,
No, yeah.
like you need to get, we
Suffocate.
need to get clearance. Like, I
Yeah.
don't know if your kid has, and a lot of kids will like, do thumb sucking or like
Mhm.
pacifier use for an extended period of time because those
And narrow the palate.
devices, they're one narrowing their palate, which is, the roof of the mouth is the floor of the nose. They're narrowing their nasal cavity at that
Right.
point, right? But, and they're also, if they're thumb sucking, they're pulling, it's called a mandibular advancement. They're literally
Mhm.
pulling their jaw forward to open their airway like a mouth guard for an adult, right?
Mm.
But also is that typically these kids are trying to like stimulate and drain inflammation that's happening in that area.
So it's a reflex
It's
to
like,
is it?
yeah, but it's this like vicious cycle that they get in that they
Mm.
like, I can't stop doing this because it helps me and it like makes me nasal breathe and I finally can when I do this and I calm down, but
Mm.
it's destroying me long term,
Right.
right? And it's just this like vicious cycle that they get in, and it's like really hard to undo that habit when they're two, because you can't be like, hey buddy, like I really need you to stop doing this because like not good for, like they're two, like they don't
Yeah.
care nor will they understand. So it's a balance of like really monitoring that and trying to support the kid throughout that process and regulating their nervous system in different ways using like more of a traditional sensory approach, like swinging the kid, trampolines, like getting him like regulated in whatever ways that you can do that so that they don't seek that or seek the other
Mhm.
one. Or there's a behavioral component to it. Like, a lot of my parents, when they call me, I'll say, okay, like if it's especially in the winter and there's that kid who's thumb sucking and like we know it's kind of an issue, right? I'll send them to like Big Bear and I'll be
Mhm.
like, wear really, really heavy snowsuits all day long.
Mm.
And just to get like deep proprioceptive input on this kid, basically to wear them out.
Mhm.
I want them with big boots on and I want the parents like throwing them in the snow. I want
Mhm.
them like on sleds for vestibular input to calm them down. I want them roughhousing. I want the kids so tired and I want mitts on them so they just fall asleep without having to suck their thumb. Right. And then you stay there for like 7 to 10 days to kind of like change that habit, and you return back to your environment, because when they're so stimulated and like getting all this input and being able to and not having access to that, that's one way to do it with a kid that you can't really like negotiate with yet.
Now,
Even
oh
like
my
4 to 6 is a good method to try to do that.
you don't think the altitude and the lack of oxygen might
There,
might kind of
I don't think so. I had like in my experience, like maybe, but the kids that I've done that with, like it's been this very, it's always this like, and most of the time the parent is like, oh my God, like, and I tell them, I'm like, it's gonna suck for 2 to 6 weeks. Like
Mhm.
you're gonna have to go in there, pat their back, calm them down, help them get back to bed. Like they might need to like cuddle with you. Like
Mhm.
they're not gonna just, because these parents are used to the kid being like, or like
Self-soothe, yeah,
self-soothe so that like
yeah.
parents can sleep, and everybody needs to sleep, right? And everyone after the first 2 years is still like sleep deprived, right?
Mhm.
And like, so I totally get it, but I really mentally prepare people, and I'm like, look, like this is gonna suck, but be prepared. But then some kids shock us and they're like, he stopped,
Yeah,
like it's totally worked, right?
right.
And if it's summer, I send them to like Palm Springs and I go in the pool, go hiking, like just get the kid out of the environment and like exhaust them, kind of
Mhm.
thing. Unfortunately, gloves
Keep
aren't a
it
thing
keep
there.
keep keep them stimulated in other senses to where they're
Yeah,
because it's the
you got to regulate them some other way.
definitely.
Yeah, but yeah, so it's like it's a thing. So those things are like, there's a time and a place for these tools because our society doesn't support women to stay home long enough really to
Mhm.
breastfeed. Like fed is best, but like breast is optimal. That's just
Mhm.
how it is. That's why like kids in like Peru or like Africa or things like that have these like big smiles.
Mhm.
All of their teeth are there. Their
Wider
wisdom
palates,
teeth
yeah.
are intact. Their jaws are wider. All that kind. They're breastfed and they eat real food, right? Then you think of cultures that use nannies more, right? Like the
Mhm.
British cultures, and like, what do you think stereotypically sometimes what happens when you like Austin Powers, like teeth are like, you
Yeah,
know what I mean?
terrible,
That's
yeah.
like, it's a thing because of like what's happening to the development of that oral facial complex
Mhm.
due to what's being put in the mouth at that point in time,
Mhm.
right? And in America, like there's like no maternity leave basically at all.
Mhm.
There's no support system for women to like to really for like a team to be there to be like, hey, let's really, if that's the mother's goal to breastfeed, like let's really try to get this going.
Mhm.
Well, because it's a complicated thing. There's like the one, there's the mother, then there's the baby. You got to check the baby's oral motor skills. You got to check how the baby's nerves are functioning. Did the baby have any compression in the vaginal canal? that could have torqued any of the nerves like in this area that control the tongue? Is the mother able to produce enough? Like the mother's nipple and breast shape, the mother's
Mhm.
like milk flow, the milk production, all that. And it's a symbiotic relationship. If the baby doesn't have the skills to elicit the response and stimulate the nipple like from the mother,
Mhm.
it's not going to go to her pituitary gland to create prolactin.
Right, right,
It's this this
right.
symbiotic
Even the
relationship.
saliva,
Yo,
they
all
were
of it.
telling you the
The nipple
saliva.
hair that women
Yeah,
grow is for that to emit like literally scent for the baby
yeah.
to smell because the strongest sensory system when they're born is scent,
Mhm.
and that's where they smell moms. That's where they calm down when they're like on mom
Yeah.
because they can smell her and then they hear her heartbeat and they
Mhm.
that's where they were for
Right.
9 months. So that's what regulates them, right? So yeah, it's unfortunate because like our society, like women just don't have the opportunity to do the what would be ideal for craniofacial development. And there's
Mhm.
no like people have to use bottles and that's totally okay and
Mhm.
fine, but it's ideal to kind of like get the baby on a mild munchie at 6 months or as soon as they can to like get the jaws like in the right place, the tongue in the right place, everything moving forward and outward.
So do you think that there's enough supplementation at this time for to kind of help with those structural kind of like developments?
100%. Yeah, people just don't know about it. It's
Oh,
not
okay.
mainstream knowledge yet. So like going like if like in a so like okay, like let's say like a lot of my girlfriends, right? Like they're having babies and things like that, and they're like, Marielly, like, what do I do? And I'm like, okay, in a perfect world, I'm like, I have maternity leave for 3 months. I'm gonna breastfeed and I'm gonna pump,
Mhm.
and that's all I can do. And I'm like, okay, let's do like in a perfect world, this is what this would look like. The mom breastfeeds for the first 4 months that she's home. Then she goes back to work, right? She's pumping just from the like all like breast milk's amazing, does so many things, right?
Mhm.
They use a bottle, whatever bottle is for that baby. There's no ideal bottle. There's
Mhm.
no perfect bottle. So whatever your baby feeds best with, and it eliminates like swallowing of air and minimizes reflux. That's the one I want for your baby. I don't doesn't matter, right? There are
Mhm.
some ones that are better in terms of nipple size and stuff like that, but generally speaking, that's what you want. At 6 months, when a baby can basically start sitting up and things like that, you want to work on like open cup drinking and like straw drinking potentially too. If you're noticing that the baby has an open mouth posture and starting to introduce the mild munchie, and you can minimize the bottles that aren't basically like right before nap time or sleep, and like when the ones that they're getting milk in a different way,
Mhm.
or like a different time of day, so they drink out of a straw to if their mouth is like this, so their lips go closer together and their lips come more closer together and then they're using their mild munchie because at 6 months they're going to start gnawing. That's what they want to do. That's the precursor to chewing.
Mhm.
That's why when you put like a baby at a restaurant they're like gnawing on the table
Yeah.
and everyone's like, oh my god, it's so funny. Like it's like a it's a like
Yeah. An
evolutionary
instinct.
thing.
Yeah.
Yeah, they're supposed to do that.
Yeah.
They're gonna do that. Like my baby's just like just like
Yeah.
munch is what they do. So if you give them the munchie, now they're munching, and teething tools are amazing, right? The
Mhm.
round ones and stuff like, but those only go back so far. The munchie is like covers all the ridges of the jaw, and it also like cleans the gums. It like kills like 14 birds with one stone. It's an
For those who don't
amazing.
know, it's kind of like a mouthpiece
Yeah, it
for
looks like a
baby.
mouth
Oh
guard, but
yeah,
for
that's a
like
mouth. Yeah, for
babies, so
babies,
for
right?
babies and toddlers and kids and things like that. There's ones for adults. Adults, it's a little bit you will change your jaw some, but it's like very case dependent. But again, they're like Play-Doh at this age. So what you put in their mouth, it will shape their craniofacial
Yeah, very
bones. So
malleable.
so that's why when you see like a thumb sucker, typically their teeth will be bucked out and they have an open bite or an overbite or
Mhm.
things like that. But the munchie brings everything to more harmony for the mandible and the maxilla, which is the upper and lower jaw, because the pressure of them chewing and everything is what facilitates the soft tissue to then have an impact on the bone. It's a symbiotic relationship between bone and soft tissue that creates the structure. Does that make sense?
Yeah.
Mm-hmm.
So I'm sure. Have you seen or what do you think of the like those jaws of size? I have a couple here. The little jaws of
Yeah,
size are like
those.
those. There's a lot of people that are talking about it now, but again, I think that we're just in the beginning of in the adolescence of how it's actually helping or maybe causing more issues down the line. We'll see. We're yet to determine. But using those to strengthen the facial structures and things like that. Like, do you know of any research or do you know of anything that is like pointed to kind of like, or do you suggest it at all?
So I don't know of any specific research because I
Mm-hmm.
haven't just like looked at the data or the journals on that. But what I will say, just from like deducting as like a clinician and just like as a biohacker and like as a person from my background, um, you want to just make sure you're not doing that when you have like TMJ or TMD. Like if you have
Mm-hmm.
any like temporomandibular like disorders or
Mm-hmm.
anything like that or any issues with your jaw, the jaw is a very fragile joint. It
Mhm.
is, you have to remember, it's like floating and it's like the hips of your face. So
Yeah.
if you mess that up, you're like,
Yeah.
and there's a lot more going on there neurologically than there is in your hips down here,
Mhm.
right? And so you kind of don't want to mess with that unless you have there's nothing concerning with your bite.
Right.
Ideally, you were breastfed and like you never had ortho and those kinds of things. If you did and you're doing that stuff and like you're feeling pain,
Mhm.
I would stop immediately. If but there is like, you know what mewing is, where people have changed the shape of their face and their jaw just with tongue position.
Mm.
It's You can like YouTube it. There's a bunch of mewing videos, and it's basically like the like I don't know how to put this, like the poor man's like myofunctional therapy. Like
Mhm.
it's like people are like, oh, like when I put my tongue up to the roof of my mouth, like my double chin disappears. It's like, yeah, because you're not resting the lower part of your tongue down where
Yeah, yeah.
it's supposed to be up there, right?
Mm.
And people can the thing is women actually see more changes in that because we're more flexible because our bodies change when we get pregnant. So nature has given us the flexibility to do those things, right? Like that's why women's like spines change and our
Mhm.
hips and everything. Men are kind of at a disadvantage because like once you guys are kind of like grown, and
Mhm.
that's why you guys kind of grow a little bit later than we do. Once you're kind of like solidly put, you're kind of solidly put, but you can make changes, but typically you require like more ortho intervention, like palatal expansion, working with like a orthodontist or like a airway centric dentist and stuff like that.
Mhm.
So like, will the muscles get stronger and like be more prominent? Yeah, but will you make actual bone shift changes with those devices? I don't think so.
Mm.
But it's like as long as it's not hurting you, like it
Mhm.
shouldn't really like do anything. And if you notice that it's helping you keep a closed mouth posture without creating any issues with like pain or anything like that, then you should be fine.
Mhm.
But I could totally see how it like improves the strength and the what am I trying to say? The presence of like your masseters and things like that. It'll
Mhm.
make it look stronger and like
Mhm.
more developed and things like that. But is your jaw actually bone like changing shape? Like I don't know. They should do
Probably.
studies on that. You could.
Yeah, well, yeah, cool. Well, I know Andrew Huberman's talked about it, and he's kind of pro using them. That's one of the reasons I got one just to kind of check it out. But he says that yeah, it's basically the reason why people look older and get older is because
We don't
it's
use our
it's a
jaws.
structural thing. It's not necessarily just the fact that
Yeah.
you're just getting your skin is getting older. No, it's just that your muscles in your mouth and your face start to atrophy over the years. Same as your legs. That's why you see people that when they get older, like there's a good comparison online of a triathlete's quads at 60 in comparison to a just normal
Mm-hmm.
60-year-old, and the amount of muscle loss that there is just
Insane.
phenomenal. It's insane.
Yeah.
It's like 30-40% muscle loss,
Totally.
and then you look at the you look at the muscle of you look at the bisection of the quadricep on a 30-year-old person compared to that 60-year-old person, or I think it's 40-year-old, and that 6-year-old triathlete, and the muscles are almost the same.
Identical.
Yeah, they're
Yeah.
almost identical. It's like
Yeah.
so you're basically keeping the same muscle structure from your 30s and 40s
Yeah.
20 years later,
No,
which is important.
yeah, and that's what I'm saying. Like the masseter that I talked about is a muscle, but like what I'm saying is like I don't know if your bone's gonna change, but your
Right.
muscles are gonna be good,
Right.
which I'm not against that as long as it's not causing you pain and
Hmm.
you might not know that you have a TMD or TMJ disorder. Like I would say if you don't have you never had issues in that area and like you're not wearing a mouth guard at night, like you're probably good. You know what
Yeah.
I mean? But if you start to feel pain, like not the call,
Right.
but you probably have something that you're not aware of, right?
Well, I'm
But
sure
I'm
people like to sit there and like, oh, this will make me look younger. I'm gonna do 1,000 reps a day. Next
That's the
thing you know, yeah,
problem.
yeah, and then
Yeah.
you dislocate your jaw because,
Sure, that's what I'm
yeah,
trying to say,
yeah.
right? It's
So
like, be
it
smart,
right,
like
exactly. Well,
yeah.
that's a relative term,
Yeah,
but
so,
yeah,
like
but no, that's why I wanted to kind of get your opinion on it because it's something that you can see. But one thing that like piqued my curiosity is just kind of the way it's shaped
Uh-huh,
now. It's just kind of like one in just like the front part of your mouth.
mhm.
So I was thinking about it, and I was like, this is almost similar to like a pacifier, and like you and kids how they get open bites and things like that. And like my wife actually, she struggles with an open bite for years because
Yeah,
she's a tongue thruster.
mhm.
So for years she's had to she's had to have braces on like 3 times to try to correct it because every time she does,
She's gotta do myotherapy,
yeah,
so she's gotta fix the habit to improve the
exactly,
structure.
yeah, yeah.
The form is following the function.
But a lot of the research that's coming out, or a lot of stuff that they're saying about it, is that back in like caveman times, prehistoric times, the food that we would eat and the way we would eat the food wasn't as relatively as accessible as we have now. So I basically we eat like mush and we eat pudding compared to what
Totally.
what we used to eat like esoterically. So the way you would rip meat from
Tear and shred.
or different things. You say like if you exhume bodies from thousands of years ago, you see that their palates are wider
So much wider.
and their faces and it's before they would think that it was kind of like similar. Oh, well, it's because it's more of a prehistoric kind of facial structure that's the development or the evolution from being apes to being humans. But no, it's basically just the same way you see monkeys and stuff like that, and apes eat, and how they eat things. They use their full mouth and they widen their palates are wide because of the way.
Yeah. So like part of it, so there's a lot to say here. So one, first and foremost, is our food has changed significantly since the Industrial Revolution, especially for babies and especially for children. Baby food in Gerber did not exist until women went to basically factories to work to prepare for all of the things that was needed for war, right? And babies were breastfed. Orthodontics truly didn't exist until that time too, because people were breastfed and then we ate real food at that point in time. Then the sugar content of our food also like went up rapidly, and then our teeth also started to decay. In addition to that, there's this book called The Evolution of the Human Head, which you would find really fascinating, and it literally shows you this guy's collected thousands of skull like fossils. It shows you literally right when the Industrial Revolution hits, how our jaw shrinks immediately. And it's been happening at a faster rate in the history of evolution since the past 200 years because of what we're doing from birth to through the entire like development of that human being and their jaw, which then impacts their skull. So as if your mandible, which is like your jaw is shrinking, your skull shrinks and then your brain shrinks. And that's a really big issue. And like, there's this like chiropractic book that I was reading, and it's like, they're calling scoliosis, but like SKULL, and it's like scoliosis. Like our heads are getting like so asymmetrical, all like these like crazy shapes, like babies are on their back way too long. Like there's all this stuff going on. And like, it's one, it's what we're eating, and two, it's like how we're using our mouths, and it's what we're putting in our mouths, and then it's also the nutritional value of that too. There's another book, I can't remember, I think it's Dr. Stephen Lin, I'll remind me, text me, and there's literally these pictures of like these like tribes in Africa that are like before they're exposed to like Western food, and then after, and it is like the change of their face, the teeth are falling out, their bites are all messed up, like they're not like, and it is like it's terrifying, and that's like what's happening, and I'm so happy that this is like now becoming more common knowledge, but like we're on the frontier of this, right? And it's just kind of like really like it's so necessary for human evolution to kind of like figure it out, because if we continue to like go down this path, it's not a pretty picture, and a lot of people are going to be very sick, and we're going to be dealing with a lot of issues that are not just that the ripple effect of where it starts in here. Like this is like a portal to your health, and people don't even realize that. Like when I go to some dental conventions, like they're able to look at your saliva now and kind of tell you like how much of it at risk you're for like a heart attack. Like it's insane what they can tell, because it goes to your airway, it goes to your stomach. Like it's the only part of your body that's exposed to the rest of the environment. Do you know what I mean? So what you put in here systemically impacts everything. And we're starting to learn that, because people are getting to the bottom of like, why are there so many issues? Why is this happening? Right? Like, why are people snoring? Why are people having anxiety? Like, where's all this ADHD coming from? Like all that kind of stuff. And like your mouth is such a reflection of like your overall health. Like, and people don't, there's so many good books. Like there's one called like If Your Mouth Could Talk, right? Jaws is another amazing book, right? What's the other one? It's like 6 Foot Tiger, like Tiny Cage or something. I'm totally messing up that title, but it's a great, these books are just like shedding so much light from all the different lenses. Like the dentists have the structure, the ENTs are talking about the other parts of it, then the therapists are talking about the function. And then like I take it to from the function of just the mouth, but also I dive more deeper into the neuro, because I came from a neuro background, right? That's like where my connection is in that world. But yeah, it's
just how they all coincide, and it's very like, it makes a lot of sense when you start thinking about it in that kind of like baseline level, because you start seeing that, well, then you got more toxicity going into your body. You got all these other toxins that you got to deal with. People are talking about how toxins, or like there's a lot, like a big trend now is detoxifying your system, and with oils and different things like that, and like how it's helped people like kids with like ADHD, or it's helped people with autism, like regulate their behavior and their food aversion, all this stuff, and like, oh, it's a toxin. but no one's really understand, okay, but how are the toxins getting in? They think that it's all just based off of diet, which it could be largely diet, because again, but
Totally.
it goes all through the mouth, through the nose, and
Yeah.
things like that.
Yeah.
So it's like those are the two things that you get things into your blood system, is either through air or through
Yeah.
digestion. So it's like, it makes sense.
Yeah.
Do you have time for another shutter?
Yeah.
Okay, we'll do
What
one
time is
more and
it?
we'll go back. All right, we're back. Okay, so what I was saying was, a popular thing now is detoxing
Yeah.
with essential oils and different things. And people that, my kid was showing and was diagnosed as having ADHD or autism, and after we did this detox, they're doing so great and all this stuff. But it speaks to what you're speaking to, but just they're treating which is kind of how society does things. They treat the symptoms and not the problem. And the problem is, the two ways you get things into your system, into your blood system and things, is either by eating digestively or by inhaling and through the air that you get into your body.
Yeah.
So you were talking about mold.
Yeah. So basically, like, detoxing there's a time and a place for it and everything. But again, like, you want to make sure that like that person's available to detox, right? So like, we also detox in our sleep, right? And like, if you're not sleeping well, you're not detoxing, and that there's a whole nother like cycle that happens with the cerebrospinal fluid of like your nervous system detoxing. And if your tongue's not pushing up against the roof of your mouth, the pump to start that detoxing like process is not activated. So there's that from a neurological perspective in detoxing. But like, the liver is really important for detoxing and all those kinds of things. But like, you also want to make sure that you're nourishing that system while you're detoxing. And people kind of forget that a lot of the time, like juice cleanses and doing this and this oil and all that kind of stuff. And it's like, yeah, okay, cool, that's all full, like great and dandy, but like, you're also removing a lot of other things, like nourish that system as well at the same time. And like, the other thing is like, some people are so like toxic, essentially. Like, there's a lot of things in our environment that are toxic, right? And like, it can be a really gnarly rabbit hole to go down, and it can be really like terrifying as a parent. But like, mold is a thing. Like, some parents like are trying to detox their kid, or they're trying to like do all these supplements or improve their diet or all this kind of stuff, and the kid actually just like can't even absorb any of it, because like, there might be mold, or there might have been exposure to the mold. And like, that is something that even like, I learned this very well as like a clinician, because I had a family that came to me from one of the islands in Hawaii, and like, that child was doing really well, like in California and in LA when they were here, and then they would go back and like immediately they started mouth breathing, and it was kind of this like, what is going on? Like, I don't understand, like, and then I was like, and I have a colleague who's like a dear friend of mine too, who had some really gnarly mold stuff, like really bad, like really like hives on the face, like daily, just like something was very wrong with her body, right? And tested for all sorts of different kinds of mold. One that was at her mom on like the house in the East Coast, in the apartment in LA. She had like 7 different types of mold, right? And so I was like, I kind of feel like it was on the forefront of my mind because of her. And I told him, I was like, I kind of feel like you should probably test her mold. Kid has all this mold. Like, he just like could not deal, and like couldn't like detox, couldn't breathe, couldn't do anything, because his poor body was just like infiltrated and like taken over with this mold. So like, it's really like, it can be really overwhelming as a parent, because like, you like,
so they tested the child for mold.
Yeah. And the parents, and like, and it's like, yeah, like there's certain people who can deal with mold, and there's certain people who can't. I think there's like 30% of the population who like really can't, like really, really can't. And it's something I feel like, if these, if you're a parent who's like listening to Andrew Huberman, if you're kind of more in the biohacking space, you're aware of these things, like, you're probably more likely and more open to like other paths. And I don't even want to say alternative, because that's not alternative. That's like actually like, oh, you have mold. Like, this is a medical issue. It's something worth looking into if your child is stagnant in the progress of the therapeutic intervention that you're seeking. Like, I tell parents that too, like, if we don't see results in 3 months, I'm not your person. Right. Or like, and like, I'm not saying that has to be life-changing results, but there has to be something, right? There has to be some type of progress. And that should be people's like general role with healthcare. Like, if you've tried something for 3 months and you're consistent and you're on it and you've been going, like, you're not seeing changes, like, you have to start asking questions. You have to start changing clinicians. You have to change the environment and things like that. Or like, if someone moves somewhere and all of a sudden their health tanks, like, you should probably consider
that was probably
you like get the house tested for mold. Like, do you know what I mean? Like, don't let it get so bad is what I'm trying to say.
Well, I didn't even realize a person could be tested for mold. Like, you could test a natural person for mold.
Yeah. And like, and like the house was tested and things like that. And like, my poor friend was like saunaing in that house. She had like a portable sauna to try to help herself, and she's just
getting more mold in her body.
she's just like expediting the mold into her body. You know what I mean? Like you don't know till you know,
Right.
right?
Well, that's the thing. Like, most people would say like, oh, maybe we have mold in the house, but there's so many places in the house that you can have mold that
Yeah.
you don't even know. Like, well, yeah,
You can't even see it a lot of the
yeah.
time.
So you're thinking like, oh, maybe
Yeah.
it's in their room or not in their room, or it's.
Mm-hmm.
We looked at the room's clean. It's like, well, it's not that. Maybe it's under the floorboards, and it's
Behind, like, yeah, it's like behind the walls. And living from mold sucks. And like in California, we get a lot of it.
Yeah.
There's moisture. The East Coast, like we didn't have like building permit stuff. Like we have like all this like lead paint and everything. It can get super overwhelming. Like do your best without like losing your sanity. You know what I mean? But it's something that I think a lot of people, if they're starting to finally like be like, oh, like you could be taking all the supplements in the world, but like if you're moldy, like you can't absorb it.
Yeah.
You know what I mean? Like you can't. You just like literally can't. So it's kind of like you're spending thousands of dollars on supplements and like for what? Right. Yeah,
Man, that's very intriguing.
Yeah, it's mold is a whole nother rabbit hole. I haven't gone down it really a lot, but I've had a lot of kids who have tested positive for it. And then and like I've had kids like they start going on like they're called binders, which is what gets the mold out of your body. Mm-hmm. And these kids, they like literally disinflate. They like they're just like and I'm just like, oh my God, you were inflamed the entire time. Wow. Like, and it looks like they lost 10 pounds, but the kid was just inflamed. Wow. And you're just like, this poor little kid. Yeah. And like, I work with neurodivergent kids and they can't tell me what's going on. You know what I mean? And I'm just like, you poor little soul. Like all these people are trying to help them. And like, you know what I mean? So it's like, mm-hmm. So it's like really important to work. Like, in my opinion, like, a functional medicine pediatrician or an integrative pediatrician, people like that who are going to like test for these things and like look and like see like, oh, your kid would like do better with this kind of like vitamin B, or like they might absorb this one better, like customized healthcare, not this like generic broad universal scope, exactly, like generalized. Like everyone's genetics are expressing themselves differently, and you have to know what your genes are. Put all the balls in your court to help with your like healthcare decisions and plans, and find the clinicians that are going to do that for you. You know what I mean? But like the one universal law is like, yeah, like nasal breathing is like good for everybody. You know what I mean? Like there's just, you can't really say much more for other things. You know what I mean? Yeah. Mm-hmm.
It's just so interesting because, and this is a debate that I have with, like with people all the time when it comes to my son. It's just kind of like, oh, this, you got to do this, or you got to do this. And it's like, you got to, and you, oh, well, the doctor said you got to do this, and the doctor said you got to do this. And it's like, if you kept track of how many times the doctors may have been wrong, not necessarily because they don't know what they're talking about, but just simply because your own biology or your child's biology is just nuanced to the point where they need something a little different or something a little bit more, invasive, or maybe not as invasive, and they just respond to things differently, and just getting away from this mindset of just like generalized medicine where it's like, this is what, oh, you have inflammation, take ibuprofen because ibuprofen is, well, no, it's ibuprofen. That was one of the things at the same time during COVID where it was like a lot of people were taking ibuprofen and it wasn't helping them, and they were ending up in the hospital and stuff like that. And because and it turns out that Tylenol would have been more, and acetaminophen would have been more beneficial to help reduce their fevers and stuff like that, because ibuprofen wasn't working. And it turns out that they've never used ibuprofen in their life, but they just heard that ibuprofen is, if you're sick with COVID and you have a fever and you can't get it down, take ibuprofen. They're taking ibuprofen, but there's somebody that's taken acetaminophen their whole life and their body responds to acetaminophen better. You know what I mean? And just different things like that. Or people that start taking acetaminophen where they're normally an ibuprofen user, and then their liver all of a sudden it's like, what the hell is this? And then it starts damaging the liver because of the fact that you don't get those kind of,
that's hysteria for you.
Yeah. And it's just wild, and it's wild that we, because then we can go into the whole, the whole medical field and big pharma and all that stuff. That's a podcast for another day. Yeah, that's more my field, but no, yeah, it's just incredible how nuanced the body is and how nuanced the body responds to medications and different things, and like my mother-in-law was going through blood pressure stuff and blood sugar stuff. So she was taking her blood sugar medicine, but she recently made life changes to where she lost a ton of weight, and she's exercising more, and she's eating better. She cut sugar out completely. She's not on a ketogenic diet, but she's basically on a diet that is just very low sugar,
clean. And
she was getting nauseous, and she was getting, and I'm like, hey, have they adjusted your meds? Because
you might not need it anymore.
Well, the thing is, you're now self-adjusting to
Not being
exactly, not being
diabetic.
diabetic or not having to take all these
Yeah.
things, you know. So it's like they need to, or like I remember my dad when he was going through his heart condition stuff, you know, there was times where he'd take some medication and he'd get worse, you know, and
Yeah.
it's like, no, they're giving me these meds, they're supposed to help, they're supposed to help, you know. And then that's kind of where I really, it opened my eyes to how nuanced illness is that my dad was like, no, we're finding the cocktail that works best for your heart, you know. So if something's not working, let us know right away that it's not working or that you're
Yeah.
getting worse, because it could be causing more inflammation to your heart. And if you have congenital heart failure and you have a problem
The last
retaining
thing you
water, the
need
last thing you need is
is
more fluid going to your
yeah.
heart, you know.
Yeah.
So it was like, yeah. And so then they finally like adjusted some things and he started doing so much better. And it's like, well, yeah, it's like this is what it is. You can't just say like, oh, my buddy takes, you know, X, Y, and
Yeah.
Z, and he has the same thing that I have. Well, no, it's completely different. You know, there's
Everyone's different, and
yeah,
like you have to be like I always like tell people like you have like parents specifically more for me, but I'm like you are your child's advocate. Like you have to advocate for yourself. You have to
right,
advocate for your parent or your when they get older and things
right,
like that, because no one else is going to do it. And you have to remember your dad in that practice is probably one of like a couple hundred people.
mm-hmm,
Do you know what I mean? And like
mm-hmm,
these we're still human.
right,
We're all doing our best.
right.
Like
Well, and
I'm
it
not
also,
saying malpractice is okay, but
no, no,
like
no, no, but it also goes to
there's testing, like everyone's trying to like figure it out. Everyone has
right,
the
right,
best
right,
interest, but like your mother-in-law, like, do you know what I mean? Like she should have immediately like I'm feeling dizzy or things like that, and that's the thing is I think that one of the main problems with the breakdown of communication is that visits aren't long enough
mm-hmm,
for physicians and therapists. We get 60 minutes with people. That's like our standard, right? So we're always the people that find out more the qualitative data. And so
mm-hmm,
that we can kind of see actually, oh, what's going on, what's improving, all this stuff. Because we actually like logistically have the time for the patient to
right,
like communicate to us. And we see them regularly like week by week by week, right?
right,
And physicians and surgeons just don't have that luxury. That's
right,
it's really unfortunate for them because they don't get the full picture. And so I literally like tell my parents, like I'm getting to the point where I want to make like a document for my parents to be like, I need you to talk to them about all these things. And I
mm-hmm,
check off these things so that they don't forget. Cause like my parents aren't therapists or not doctors.
right,
Some of them are, most of them aren't. They're like, you know, producers or accountants or whatever. And like if somebody told me to like go to the IRS and be like, hey, don't forget to ask all these questions, I'd be like, Gah,
right,
you
right,
know what I
right,
mean?
right,
And I have to remember like they don't know everything.
right,
So like people have to tell the story of
mm-hmm,
all the things that are going on and get their clinician to listen
mm-hmm,
so that the clinician can see the whole story, because they're going to remember everyone's going to want to just go off the labs. They're going to want to go off the testing, all those things,
right,
which help make like quantitative like informed decisions. But
right,
qualitative data is also very, because you can like literally like the research is there, right,
mm-hmm,
for quantitative data, but you have to remember if you're going to look at it, and I just had this like thought now, like you yourself to your clinician, you're a case study.
mm-hmm,
So qualitative data matters a lot.
right,
Do you know what I mean?
right,
Like, so what's going on with you? And
right,
like, if you don't paint that picture or tell that story, like they're just going to go off of whatever like data that they have, which might be quantitative. And there's two sides to every story, or like
right.
you have to see the whole story is what I'm trying to say.
Definitely, definitely, definitely.
Yeah. Mhm.
It'd be fantastic for them, and with technology the way it is now, to have almost like a daily journal of like, hey, we're changing your med, so I need you to log into the daily journal,
Mhm.
and it's, you know, all your data's kept on here along with your medical records, and then just tell me day what you ate, what may have happened, this, that, and that, and any kind of uh, any kind of reactions you may have had, any kind of things.
Yeah.
So to daily document, and then you can kind of see, okay, like, okay, at day 3 they
Yeah.
started getting better, things started getting better, so now
Yeah.
their bodies may be processing
Mhm.
the change to the meds a little better, or starting to understand and starting to do what it's supposed to do. Give it some time, and then you gotta understand, and you have that data, as
Yeah.
opposed to just looking at labs and looking at other things where it's like, well, yeah, I had a giant cheeseburger and a milkshake right before I had this, so yeah, my glucose is through the roof,
Yeah.
obviously, because
But that's where technology also comes to. Like there's continuous glucose monitors, right? That you
Mhm.
put a CGM, you slap it on there.
Right,
And now
right.
there's an app doctor can just be like, but what happened here? What is-"
Let me just explain. So the camera went off. I don't know how much of that last conversation you got, but we're basically talking about mold,
Yeah.
mold and how mold affects people, and how they can actually
Like it doesn't allow healing.
it doesn't allow healing, and doesn't allow. So I really sucks that I missed all that, and Marielly's gonna have to go, but we'll definitely have her back for more and do another podcast and get
Yeah.
deeper into things. But thank you so much for coming.
Yeah, this is
I
great.
love you to death. This
Love
was
you
awesome.
too.
I'm glad it wasn't I'm glad it wasn't as awkward as I kind of thought it was going to be. I was
No,
like kind
not
of
at
worried. I
all.
was like, I hope. I was like, this is my like the first cousin that's been on the podcast and everything. So, but thank you for coming
Yeah,
and
of
thank you for all the
course.
information. It was awesome, and I look
Yeah.
forward to sending this out to everybody, and hopefully everybody gets something
Yeah.
from it, whether it be about the importance of nasal breathing, or may it be how nuanced the human body is, and how medicine and how things uh, may make you react or get better, and to um, always look to finding a solution. And if a solution isn't working, like you said, if a solution isn't working within 3 months of whatever you're doing, and you're doing it religiously and you're doing it the way you're supposed to, there might be something deeper that you may want to look into. And
Always advocating for yourself.
right, and always advocate
Yeah.
for yourself.
Yeah, you like remember like the clinician is only as good as the information that they get.
Right.
Like we need the information. Like we need and we need to know like how things are going, and being overly communicative with somebody as a who's like the leader of your team to get you better is like not a bad thing.
Awesome. Well,
Mhm.
thank you for coming,
Yeah.
and until next time, guys, we'll see you. Shoots.
Awesome. That was great.
And I've been down.